Bismillahirrahmanirrahim. Welcome to my channel. Today I will talk about myocardial infarction and identification of MI on ECG. So first we will define what is MI. Myocardial infarction, that is heart attack, is the irreversible death necrosis of heart muscles secondary to prolonged lack of oxygen supply. MI are of two types. The first one is ST segment elevation, myocardial infarction, STEMI, and non-STEMI, which is non-ST segment elevation myocardial infarction. So in STEMI, we will discuss about interior wall MI, interior wall myocardial infarction, inferior wall myocardial infarction, lateral wall myocardial infarction. The last one is posterior wall myocardial infarction. We have 12 ECG leads, 6 chest leads, 6 limb leads. So how we put ECG leads? In a given diagram, you see 6 chest leads, which is V1, V2, V3, V4 and V5, V6. These all are chest leads. Other are limb leads, which includes 2 are on hand and 2 are on legs. AVR and AVL are on hands and 2 are on legs, which is AVF, and 1 on neutral. And the first one, interior wall myocardial infarction, diagrammatically show interior wall myocardial infarction, which is clot or thrombus formation occur in the left interior descending artery as shown in the figure. On ECG, interior wall myocardial infarction, we see interior wall myocardial infarction in lead V1 to V6. Prominent ST segment elevation in V1, V2 and V3. You see in a circle. The next one is in inferior wall MI, clot or thrombus formation occur in right coronary artery. They are on inferior valve MI, which shown in the diagram. Changes on ECG, inferior wall myocardial infarction is ST segment elevation in lead 2, 3 and AVF. In a highlighted portion, you see changes in lead 1, 2, 3 and AVF. Lateral valve myocardial infarction. Lateral valve myocardial infarction, clot or thrombus formation in the left circumflex artery, LCA. As shown in the given diagram, you see clot formation. Changes on ECG in the lateral valve myocardial infarction, ST segment elevation in lead 2 and AVL. The last one is posterior valve myocardial infarction. You see in a diagram, posterior descending artery, clot formation occur in posterior descending artery. Occlusion of posterior descending artery lead to posterior valve MI. Posterior valve myocardial infarction rarely occur independently. It's mostly occur with inferior or lateral valve myocardial infarction. Changes on ECG in posterior valve myocardial infarction. In standard 12 leads ECG, ST segment depression in lead V1 to V3. At the highlighted area, you see ST depression in the lead V1 to V3. Tall upright T wave, tall broad R waves, which is greater than 30, dominant R wave ratio less than 1, greater than 1 in lead V2. Posterior ECG leads, how we put V7 to V7 in back area. On posterior leads, ST segment elevation in lead V7 to V9. The highlighted area on ECG, you see ST elevation. Thanks for watching. If you like my videos, please subscribe my channel and press the bell icon.